Thank you. It's beautiful out here this time of year. In the past 9 months, my administration has initiated the single greatest mobilization in U.S. history, pioneering, developing, and manufacturing therapies and vaccines in record time. Numbers like nobody's seen before. No medical breakthrough of this scope and magnitude has ever been achieved this rapidly, this quickly, and we're very proud of it, and I had tremendous help from the military, generals, admirals, and many of the great people at the White House. Operation Warp Speed is unequaled and unrivaled anywhere in the world, and leaders of other countries have called me to congratulate us on what we've been able to do, and we've helped many countries with their ventilators and all of the problems they were having, and I'd like to congratulate everyone involved in this effort. It's been an incredible effort. As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective. This far exceeds any and all expectations. Nobody thought they'd get to that level. And we have others coming which we think will be at equal level, maybe more if that's possible. In July, my administration reached an agreement with Pfizer to provide $1.95 billion to support the mass manufacturing and distribution of 100 million doses, with the option to purchase a total of 600 million doses shortly thereafter. Our investment will make it possible for the vaccine to be provided by Pfizer free of charge. And with that, I just want to ask some very talented people to come up and say a few words. General Perna and Dr. Crazzzyyy have been incredible.
Thank you, Mr. President. Hi, everybody. So Operation Warp Speed's mission is to enable and accelerate the development of vaccines and therapeutics to help control the COVID-19 pandemic and save lives. On May 15th, almost 6 months ago to the day, we stated the goal of the operation, which was to have vaccines and therapeutics available and approved for use in the U.S. population by the end of the year 2020.
PBS News correspondent David Martin on Operation Warp Speed.
I was told to have available a vaccine for all of Americans.
For our story this week on 60 Minutes, we got exclusive access into Operation Warp Speed.
But what's going on in there is growing a virus?
Yeah, exactly.
The federal government's plan to manufacture and distribute 600 million doses of COVID-19 vaccine. Four-star General Gus Perna leads the operation, and he told us one of the challenges he faces is that most of the vaccines require 2 separate shots.
The second dose has to be stored and executed with discipline. It is probably our most vulnerable piece in the distribution.
So in the meeting, you said the greatest vulnerability is that second dose. Why?
5 of the 6 vaccines require 2 doses. And so what we want to do is make sure that in our distribution plan and eventual administration of the vaccine to an individual, that we have the second dose available. We don't want you, David, showing up, getting your shot, being told to come back 21 days later, and the second shot is not there.
Tiberius is a proprietary software program created for Operation Warp Speed.
You can turn on where your hospitals are, where your pharmacies, your nursing homes, and where all of your enrolled providers are inside.
It's supposed to link together different databases to allow Perna to track the vaccine every step of the way from manufacture to inoculation.
Pfizer and Moderna reported the highly successful results of their vaccine development, each achieving a COVID vaccine that is over 90% effective. We know Moderna is 94.5% effective, Pfizer 95%. That is extraordinary. In July, the Trump administration, as part of Operation Warp Speed, agreed to provide Pfizer with $1.95 billion to manufacture and distribute their COVID vaccine, allowing this vaccine to be provided free for the American people. While Democrats were pursuing a highly divisive and entirely baseless impeachment endeavor as far back as January 13th, this president, the Trump administration, and the National Institute of Health was partnering with Moderna and working on this vaccine for the American people.